So we just came back from our kickoff here in Fredericksburg, Virginia. And granted, we've been up and running here for the better part of a year and a half, but we recently relaunched Rebirth 2.0 and rolling out every single state. We're in 22 states now, under a kind of a new model, a way for us to continue growing, but really growing in the right way where everyone is pulling on that same string. Everyone is really geared up toward the same goals. And then again, we're putting our patients first. We're putting the ability to heal our patients in the right way, making sure that we are really top of the line when it comes to compliance, when it comes to standard of care, and we are leading the way in this industry of the wound care or the wound healing space. So I think it's a really good time because it's fresh in my mind. I'm excited, I'm invigorated, but to come back and reflect on some of the lessons, some of the key takeaways, and the things that I think were so important as we came out of our Virginia boot camp, our Virginia kickoff, whatever you want to call it. So there were 15 of us in the room, all of us here, the division managers that cover the various territories of Virginia, our clinical team, the founder. Everyone was in the room, just working together, deep diving, going out into the community as well, so that we can continue to learn, to grow, to expand our knowledge, our skills, so that again, we are able to position ourselves as the premier wound healing service, not just in Virginia, but across the country. So a couple of things we really hammered home, again, just for high level overview of kind of what we do in our service: Rebirth, advanced wound healing. We are a mobile wound healing practice. And one of the tools that we have in our arsenal is advanced biologics, or the ability to use grafts, specific type of skin substitutes, advanced biologic grafts, often from amniotic tissue, to be able to facilitate healing for chronic wounds. And these are often, seniors, folks that have been dealing with these chronic wounds for months, for years. They have home health. They've been going to the wound clinic, and it's significantly impacting their quality of life. And we're able to come in, partner with that home health company, partner with the physician, and really work on getting these wounds healed significantly faster when we're able to apply these advanced biologic, these specialized grafts for tissue healing. So that's what we're doing in a nutshell. Now, there are a number of these companies, these wound care clinics, these mobile practices that are popping up. And as we dove in this week, over the course of Monday, Tuesday, Wednesday, we got to sit down with our clinical team, our clinical leadership team. And some of the things that really stood out to me, again, is our ability as a company and as a whole to deepen our understanding of the clinical applications for not just the wound care, but the specific types of grafts that we are using to help these patients heal. And as we were diving in, what was something that was a key takeaway for me was the importance of medical necessity. Now, why do I even bring this up? Why is this important? And if you haven't had any experience with a wound care company or mobile practice, oftentimes you might be familiar with the fact that they're just coming out here, they're just grafting, or they're just abrading, they're just doing a various number of things. And for us to be able to have our advanced practitioners, so nurse practitioners, physician assistants, go out there, collaborate with the overseeing physician, collaborate with home health, do their advanced assessment as well to determine if really what the best course of treatment for this wound is. It's not, hey, we go out there and we just apply a graft to everybody, because not every single patient really should get a graft. Not every patient should have the same course of care. No, I think that's pretty self-explanatory. That's the way things should be done, but oftentimes it's not. And so when we're going out there, our practitioners, really what they're trying to determine obviously in collaboration with the other team of healthcare practices that are in there, is medical necessity for grafting. What is the appropriate treatment course? Now, when we're looking at these chronic wounds, again, we have to determine, one, is this a chronic wound? Because right now, when we're determining, should we lay an amniotic graft or any of the grafts that we have, the first piece is, has this patient failed conservative treatment? Now, that is the standard of care. Now, what does that mean? The patient has been getting traditional wound care and it just has not worked. So we're looking over the span of, at minimum, 28 days. Now, oftentimes it's much longer than that. But if this is a fresh wound, somebody just had maybe a surgery, the surgical wound, or there was an abrasion to their arm, maybe they're in an assisted living facility, they're walking around and they scrape their arm on the wall or whatever it might be, or a wheelchair, and now they have some newly open tissue there. That's not something that we would graft, because what might be more appropriate, or is likely more appropriate at that time, is conservative care. And so as we're looking at this, one, we have to define, is the wound, or determine, is the wound chronic? And we'll be able to obtain this from notes from the physician, notes from maybe the home health company that's out there. Number two, from a medical necessity standpoint, when we're looking at, have they failed conservative treatment? Well, what has been done, right? So we want to see the type of wound care that's been applied over the course of at least 4 weeks, but oftentimes longer than that, to justify us going out there and potentially using advanced biologics. Now, is the patient seeing improvement? Right? Are they seeing improvement from the traditional measures? Has that wound started to decrease in size by at least 50%? If the answer is yes, well, fantastic. Continue on with the therapy, the treatment that you're already getting. But if the patient has gone 4 weeks, 8 weeks, 12 weeks of conservative care in terms of wound healing, and they have not seen at least 50% improvement in the size, well, then perhaps a graft would be appropriate for the patient. So our clinicians are going out there and determining that, obviously in conjunction with the home health. Now, on top of that, it has to be a wound that we believe we could heal, or we could significantly improve utilizing an advanced biologics, an amniotic graft. Now, if we're looking at, say, an arterial wound, well, that will oftentimes tell us that the blood flow to that area is not very good, or maybe non-existent at all. And the likelihood of that wound healing is, with any measure, is going to be very small. So would it be appropriate to lay a graft on a wound that we know is never going to heal because there's actually no blood flow, or very minimal blood flow to that wound? Well, the answer is going to be no. So it would be a misutilization of resources, and maybe creating some false hope and unnecessary expenses as well on that piece. So we look at the type of wound and make sure that there's a reasonable expectation that this patient could heal. Now, so many factors go into wound healing, and some of that is going to be nutrition, right? Is this patient a smoker? Is this patient, what is their mobility status? Are they able to get up and potentially move around, offload that wound? What support do they have at home or in a facility, wherever they are? So there has to be this multifaceted approach to understand the patient as an individual, and to understand the complexity or the completeness of their health situation, so that if we are applying graft, if we are going to utilize that, there's a reasonable expectation. We believe that we can really help heal this patient. So those are the things that we're looking at. And the reason I bring this up is because what I'm starting to see now in the market is there's a perception from maybe some healthcare practitioners, maybe from some home health, that are starting to see a lot more of mobile wound care practices in their market that they're collaborating with. And the perception is, they just go out there and, depending on what type of services they do, and they just debride everyone, or they just come out and they lay graft on everyone. And that is the exact opposite of what we're doing here, because again, we're looking at the patient as an individual, and we are ensuring that the course of care, the course of treatment that we were doing is exactly appropriate for that person. Now, you would think that all practices are doing this, but unfortunately, that's just not the case. So that was something that was really hammered home with us, and what we're looking for when we're helping to get documentation, when we're educating our referral sources, like the home healths, like physician practices. There's so many different referral sources that we collaborate with that, they, our job is to educate them on who we can work with and who we can't, but also to really paint that picture of us being a really good partner to them, because we're looking at each patient as individual, and it's the total comprehensive care, and it's not we're going out doing the same thing for each individual. So that was a huge key takeaway for me. Again, it was something that I knew, but it was really well reinforced over the past couple of days, and just having those deeper discussions with our clinical leadership team and how important that is. Because I think what's going to start to happen, particularly as more mobile wound care companies enter the market, it starts to get larger and larger and larger in each state, is that one, there's just going to be more audits, but also there's going to be more negative experience. There's going to be some more experiences overall, but we're going to start to see more negative experiences. And our whole job here is to ensure that those are kept to a minimal, because we are setting the standard of care, because of the way that we're approaching this really is what is in the best interest of the patient. And we're not looking at us taking the same course each and every time. So some of the things that we're looking for as well, outside of, not just on the medical necessity side, is educating our referral sources, educating our potential patients, the community, on wounds that we can't treat. Because that's just as important, because sometimes, we're going to be looking at that, and we might refer to, a different service, different discipline, or different practice. Now, you heard me mention, those arterial wounds because of the potential blood flow issues, and we can't reasonably expect that patient to heal. Additionally, if a patient has active cancer that has caused a wound, obviously we're not going to be laying a graft with all of these healing and stem cell properties in it to potentially multiply what's going on there on the cancer side. So active cancer is a big contraindication for us related to the wound. And additionally, if there is an active infection that we're concerned about, we're not going to lay graft. We have to address that first, and which is one of the major benefits of having an advanced practitioner like some of our NPs or our PAs that are going out there to assess these patients, because they're able to utilize different techniques, and in terms of, one, just laying their eyes on that and determining, hey, do we need to get a culture of the wound, or if we're using advanced imaging as well, to be able to determine where maybe that that infection is, or if it's a specific type of strain, different types of things like that that are going to really help. From the course of care, it's just best practice, but also the home health companies that are out there, as well as the GP, the general practitioners, the physicians that are overseeing this. So when we get our practitioners out there, if it seems like a wound that we could graft at some point, but they suspect there's an active infection, they're going to hold off and address that first. Same thing in terms of prepping the wound bed. If there's a lot of eschar, if there's not a lot of healthy tissue around there, we're not just going to go in and lay graft on that, because it's not something that would work at that time. But there's a lot of prep that goes into the wound bed itself and the peri-wound, the area around the wound, in terms of debridement, to be able to get that wound in a state where it's most likely to heal and receive the benefits of these amniotic grafts that we're laying. So again, I'm just hammering home the clinical importance and the piece here, so that us as clinicians, but also going out there into the community, talking to our referral sources, again, our physician offices, our home healths, our assisted livings, our skilled nursing facilities, long-term care facilities, all of our partners, so that they know what to look out for as well. Again, it's just going to make us way more successful over the long term. So as we continued our kickoff, our boot camp here over the past couple of days, another key takeaway or something that was reinforced to me, and I saw this when I first started, I saw that and I continue to see it, but being in the room with our team, our clinical leadership, hearing everyone's perspective on this, we know that there's more and more wound care companies that are popping up, that are coming out here into the market, into the various states, week after week, month after month. And so we address some of the things that, on the clinical side that are going to help set us apart. But to me, one of the biggest things that I think is not overlooked, but is so important, like easy to talk about, but sometimes difficult to execute on, is the true collaboration and communication and coordination between all of the parties, between ourselves that are out there as, our role as division managers, we're those liaison in the community, with the patient, with the home health, with the general practitioner that's overseeing that patient, and then our providers as well, to truly coordinate that care with the patient at the center here. And everyone knows, because there's a lot of moving parts. If you've had any interaction with mobile wound care or home health, you know that, say, for example, a patient has been in the hospital, they get discharged, they go home, and they're, maybe it's 85-year-old Mrs. Smith, and she has a wound, maybe in whatever her hospital stay was for. Home health goes out there. They've got all of their documentation. They're coordinating visits with their nurses, with their therapists, whatever disciplines were ordered coming out of the hospital. Mrs. Smith might have 2, 3, 4 other specialists that she is working with as well. Maybe she has a history of diabetes and heart disease. She has all these other specialists that she's working with. So they're overseeing her as well. GP, the general practitioner, is kind of overseeing everything from the high level. Home health is out there. They're treating Mrs. Smith to get her back to her kind of baseline or above in terms of her mobility status. And maybe she has this wound now as well. They're treating that. And there's a lot of moving parts from a coordination standpoint. And now we get called in as the mobile wound care provider. And so we're coordinating with that home health team. So their nurses, their therapists, we want to make sure we're not going out on the same day as them. From a scheduling perspective, we're coordinating and really getting the general practitioner up to speed, making sure they're okay with what we're going out and doing as well, and everyone involved. And so many companies, preach, yes, communication. But from what I've seen, what I've experienced, and just from every single provider that works with us, every single division manager truly cares about ensuring the patient gets what they need. And when it comes down to it, the piece that's going to ensure that is the communication and the follow through and the coordination across the board. So for us, we are constantly communicating with our provider, so our physician assistant, our nurse practitioner, who is going out there and treating this patient on our side. And then we're getting those updates. We're excited that Mrs. Smith's wound is starting to heal. We're starting to see that progress. We're communicating that information, the progress, all of that, back to the home health, back to the physician. If there's any changes, any orders that are coming from our advanced practitioners, those are being communicated clearly and quickly to the home health company that's out there as well. If there's any change to the days. And again, with all these different moving parts, it can very easily get lost in the shuffle, but it's something that is such a focus for us. And I've seen such amazing execution on it. And I think it comes down to a couple of things. One, we've hired really good people, and everyone truly cares and are bought into that mission of how important the communication and care coordination is. And so without that, it would be very difficult for us to have success over the long term. Sure, we can get some patients seen, but what's going to have us stay in the game and go from here to here, in every state that and every case that we take on with every referral source, every partner that we have, is our ability to maintain that A+ level of communication, quick care coordination. So that's something that really stood out to me, and how important it was across the board, and how bought in everyone in the room really was to that. So it's super exciting. And again, just coming back and reflecting on these things, reflecting on, the countless patient stories that were shared as well. Our clinicians went above and beyond. Our division managers are going out there and meeting with the patients, really listening to them, to their stories, and how much of an impact these grafts and the treatment that we're providing has changed their lives, and brought them to a position where, well, maybe they had lost hope that this wound would ever heal. And now we're getting them to the point where either the wound has closed, or we're so close, their pain has subsided. And hearing those stories over and over and over again is just really invigorating and exciting, because I'm seeing them a ton in my market. But to hear that from Roanoke, to hear that from Richmond, Fredericksburg, all the way out to Williamsburg and Suffolk, every single market that we're in Virginia, and really across the country, we're hearing and seeing these stories. And it reminds all of us why we do what we do. So as we're getting out there in the community, sometimes, there's traffic, there's roadblocks, there's all these things that can get in our way. But I'm reminded today and daily of the impact that we're having in these patients' lives. And to me, that's the most important thing, because we can go out there and do anything in our careers. We're all healthcare professionals, but to be able to come back to this and have a passion for wound healing, have a passion for the stories and the individuals, the people's lives that we are impacting over and over and over again. Again, it re-energizes me, it reinvigorates me to go out there and connect with as many people as possible, so that anytime they think of, oh, this person has a wound, they're calling us because they know that we are the best opportunity for that person to potentially heal. And so that's why I do what we do. And that's why I do what I do. And that's why we as a company do what we do. And again, that was my reflection over the past couple of days. And hopefully somebody out there hearing this, if you know of anyone who has a wound that they've been dealing with for months or years, you just want us to take a look, to have a conversation about that. We're always willing to have that conversation and see if what we do could potentially help you or somebody that you know. So again, hope this was helpful for somebody, and I'm super excited to connect with more of you, and see how many lives we can impact.